Hey, how are you?
I'm doing okay.
Thank you so much. I promise I won't keep you forever. And I appreciate you taking time on your Saturday to talk to me. What I really wanted to cover was your background and how Guardian came to life, what it means to be a fear free and AAHA accredited high standard clinic, and like your culture and operational pressures that you're navigating now. And finally, how tech and AI might support the kind of care you believe in. Because I was doing some research on you and it says that you're really interested in integrating parts of AI into your operation. And I just wondered how you were doing that. Or maybe you're not. Maybe that's
Yeah.
wrong. Start with introducing yourself and your business.
My name is Cheryl Roth. I am a co-owner and medical director at Guardian Veterinary Care here in Portland, Oregon. I have been a veterinarian for over 2 decades now and have explored different areas of the profession throughout my life. So I started out in general practice, moved to emergency medicine for about 8 to 9 years, but then was missing out working with clients on a long-term basis. And my business partner and I and good friend decided to start our own practice about 4 years ago in the midst of COVID.
Great timing.
Yes, perfect timing. We actually made the decision about a week before everything closed down in the world and went, I guess we'll just take our time doing this.
Yeah, it gave you the gift of time. When do you ever have that?
We're like, oh, this will probably add an extra month or two to the planning list or whatever.
Did- How long did it really add?
Oh, since I didn't really know how long it was going to take us to get up and going, I'm not really sure. It was about a year.
Long
Um,
enough.
we took our time and were very thorough and had all of our meetings over Zoom. I missed out on a lot of free lunches, I think, along the way, but it's okay.
Unfortunately.
Yeah. And so we started our practice about 4 years ago, and it's been amazing. We just celebrated 4 years
Congratulations.
summer, and we love it. And we love it because we love our staff. Our staff is really what makes it. And so we're a general practice, but we practice a lot of advanced medical procedures, a lot of advanced surgery and dentistry. We have our own biosafety hood, so we practice oncology as well. And so we really enjoy being that in between sort of the general practice and some of the more advanced specialties in our area. So we can do a lot of things for our clients that
Did
maybe
you
other
have
cases might
to
need moved
did you
on.
have to go back and get additional training for the specialty work that you're doing?
Yes, in that every veterinarian is expected to do continuing education. And so we've had a lot of years between the two of us to go back and continue to do that. I have a very special interest and love for dentistry and oncology. And so I've spent a lot of extra time researching, continuing to do more and more learning in those fields over the years. We both actually still love emergency medicine and still see a lot of emergencies where neither of us are very good at saying no to anybody. So
Yeah.
we still practice the emergency medicine aspect of things when we have to and try very hard to get our clients settled before we have to, if it's an overnight sort of continual care thing needed before we move them on to our partners in the emergency departments down the road.
Tell us what makes Guardian different. What was missing from your experience in like traditional practice models or ER medicine that you wanted to do differently?
Yeah. And for us, a lot of it was we've had an opportunity to practice really high quality medicine throughout our careers. I think it was that really emphasizing that it's about the relationship in practice. So many folks think that they can come into emergency medicine because maybe they don't like working with people or have a harder time working with people. And so they want to really just emphasize, I just want to be here for the animals. But really, veterinary medicine is all about relationships. So it's the relationship between the client and their pet, that bond that they have, and respecting and appreciating and recognizing that. It's the bond between the client and the staff, and what kind of level of trust that exists there is so critically important because nothing can happen without that trust level there. And so we've
Right.
got to be able to connect. And it's truly that bond within the team that we've got to be able to trust each other wholeheartedly, that we've got each other's back all the time, that I trust my team to be able to do the things that they do so that I can, as they like to tell me, go do doctor things and let them do their things. And had to get to a point where I could just trust and let go, that they know what they're doing and they're the very best ones for those jobs.
How did you do that? Was it through your process of vetting new hires, going through onboarding, continuing education? How did you decide that you had trained them enough that you could let them do their thing?
Yeah, a little bit of everything. So some of it is who we hired for people who had those people skills too. We've known a lot of people in the community. And so as they came in to us, I trusted that they had the skills that they needed, or we could continue to train those. We've got training programs being implemented and making sure that everybody's at that skill level technically, but we've emphasized even from hiring that we're hiring for people skills. We're hiring for somebody who's willing to go above and beyond for our client. We're hiring because we want to practice kindness. We want to be a strong team, that we want to hold each other accountable. We really have these set of core values that we really emphasize, and we bore probably the heck out of people when they come to interview with us by sitting down and kind of having this big long lecture about how these things are really important to us, because we really think finding that right fit, somebody who's on the same page with us, is super important.
How do you maintain those standards day to day without overwhelming your team? I know you guys you've earned the fear-free status, and that's not something that's easy to do, and you got it really quickly. So, I mean, how
Yeah,
do you keep everybody from feeling completely overwhelmed?
some days we don't 100% admit, and my staff will agree. Some days we don't. Some days it is overwhelming, but we spend a lot of time on our culture. We spend a lot of time at our meetings talking about it. We just completed a 2-day conflict management course for the entire staff. We had a couple of
Did you
people who
have somebody
graduated.
come in and do that, or was it something that you just did on your
It
own?
was a virtual program that was done online.
It
It
was
was a
good.
group that we belonged to. It was really great. We got about 90% of our staff able to go and attend. It was like 4 hours for 2 days in a row. We have
Nice.
shut down to bare bones at the clinic, just because we feel like it's so important for staff to continue to grow those skills. Those
Mhm.
EQ types skills are not skills that are trained anywhere else. They're not trained in school. It's not something you learn in school. It's not something that most people learn on the job. And so we're trying to really emphasize that those people skills, being able to communicate, being able to handle conflict in all of its forms, whether it's just a stressful situation because the scenario is sad, or someone's truly not getting along, or a client might be upset because they had expectations that weren't met. We just really want to set everybody up for success.
Yeah, it's
And
such an emotional industry with such a narrow margin for error.
yeah,
You do have to do so much training and constant training and nurturing your staff to make sure that you don't suffer burnout and things like that. Because
yeah,
I see that it's rampant through the industry. It's just,
it certainly is. And we're
yeah.
not
You've been
without.
in it a long time and you're still going strong. So, how do you think that you've managed to avoid feeling like that?
I truly love what I do. And I feel very grateful every day that I get to do the job that I've wanted to do since I was 3. And I'm stubborn as I'll get out. So I just never change my mind. But I try to really focus on positive, the things that we can do that make a difference with our patients. I try to surround myself with people I enjoy working with. My team that I'm working with now, I am so excited to see them every day.
Oh, that's so nice. That's really refreshing.
Not a morning person, so I'm not happy to see anybody first thing in the morning, but
They
uh,
probably recognize that and they give you space.
most days, yes. Some days it's just let me put my bag down for a brief moment. But yeah, I truly enjoy who I work with. I love that I have a co-owner, a partner in crime, and a very dear friend in doing all of this, and that makes a huge difference.
I bet
For
it takes
me.
a lot of pressure off, doesn't it? When you have
It,
two people making
it
decisions.
does. And you can
Mm.
have a moment where you're like, you know what, I'm going to be off the clock this weekend. I've got stuff going on. Are you good handling that? This weekend, she's out of town and quite literally not available by phone. And so I've got
So
the
you're
brunt.
on.
Something happens, I'm here. We both have spouses that are very supportive and families that are very supportive of what we do as well, too, which I super appreciate my kids for tolerating me being gone and busy and working long hours some days. And some days I'm able to get out and be there and do the things that they need me to do for them
Mm.
too. So it's
Mm.
really, it's
What
very,
pressures are most affecting you now? Is it financial or staffing, scheduling, or just something else altogether?
related pressures. Thankfully, this summer is relaxed a little bit. We've had a lot of folks that were out ill. So we had some staffing challenges. We'd be short staffed for a bit, and not because we needed to hire anybody, but because we had a decent number of staff members that just were ill. COVID would go through the clinic and everybody'd be out sick. And then it puts a lot of pressure on those who are there. Not that it's the people who are sick's fault of any sort.
Yeah,
Those are oftentimes our challenges. Usually the biggest challenges are people and relationship based,
I hear that. I
which is
swear, I
where,
think I hear that every podcast I do. It's relationships. Yeah.
yeah,
Yeah.
we
What is
have,
going really well for you and your team right now?
we're flowing at this point. So we hired some new staff members a little less than a year ago. They're doing amazing. They've gotten to that training period where they know what's going on now. They've hit their flow. We added a new doctor a little over almost a year ago, and she's amazing. And our staff and our clients just love her. And so things are they're flowing. They feel appropriate.
You're running
I
on
hold my breath,
cylinders.
waiting for the other shoe to drop.
Don't say that. Don't say that. We'll just stay on track and hope that everything keeps.
Eh,
So you were telling me what's going really well for you and your team right now.
Yeah. So we've really hit our flow at this point. We've got our staff members have been with us long enough, that training, that period of how do we do things here? Who are we? How does this thing flow? Really has hit its stride. We finally are at a point where we've got most people healthy, back from maternity leave, back from surgical leave, that we've got enough staff members to do the job every day. And most folks are in a pretty good spot at this point.
Is there
And so
anything that's been like difficult to solve, just other than relationships? Anything that you're like, you come in and you're like, I wish I could solve this one issue.
our challenge is always that there's never enough hours in the day. There's never enough time to, as a business owner, to do all the things that I'd like to do.
What's eating your hours that you feel like is unnecessary? You wish you could take it off of your plate so that you can focus on your clients and the pet.
Yeah, we've done a number of those things. And so, like, we've added AI related scribing for us, which has taken a huge burden off of our plate. The things that are eating us right now are things like marketing, any online presence, that sort of thing always takes a backside to the medicine because patients come first, clients
Sure.
come first, and then everything else becomes an afterthought. And there's all those little day to day things of, I wish I had better client education materials that I could send home to get out there for our clients. We have a decent number, but there's always something that comes up. I wish I had more time to research this or look further into this or have the time to jump on and ask some questions online from some other veterinarians about a case. Although we usually make time for those things and everything else gets passed over.
Yeah. Yeah.
Training is always something that kind of falls to the wayside. We're trying hard to take some time to continually update our training process and those kind of things. We continue to try to identify what are those things that we could find something technical, somebody outside of the profession, somebody else to kind of offload those things on. And those are the things I think that are probably the most helpful right now. Veterinary medicine is really in this. We need AI, we need tech, we need something to help us focus on what we really want to do. And I know I love being a practice owner and the numbers and all of those things. I've got a lot of support and helpful, but it's all the other little things every day that having more time to focus on what we want to focus on, our
Right.
patients.
Where would you like to see your vet clinic in 6 to 12 months?
We're hopeful that we're going to get to add a new doctor, a new graduate doctor, which will be a first for us as practice owners. We have a couple of associates, but everybody's pretty well experienced, going to have some background. And so we're hoping to hire a new graduate coming up with this graduation cycle. And partially because we want to open up more space and more time for appointments and be able to get our clients in a little bit faster with their needs.
Do you want to expand your hours?
Yeah, potentially hours, but definitely our ability to see more patients.
Do you have this physical space?
For now, we're in a 10-year lease and we're stuck in the middle between a couple other businesses. So I'd love some more space. But until somebody goes out of business or leaves or moves on to bigger, better things, we are where we are.
You have to make do with what you have.
Yeah. And we physically have the space. It's just starting to feel a little crowded, but we have time. We have days where we definitely could see more. We definitely have some rooms available. We're a pretty heavy surgical and dentistry practice. We're about 25% of all of our income. What we do is that. So we spend a decent amount of time back there doing that. And so we've got the space. We're just continuing wanting that flow in. And then I'm trying to figure out how do I, as the medical lead and as the one specialist in our clinic right now, how do I make time to mentor a new graduate and spend the time with them that they need? Because one thing we really pride ourselves on is trying to be a teaching hospital. And we invite and welcome students all across the spectrum there to come and spend time with us and visit with us. So we have high school students that are interested in veterinary medicine that come in with us. We have
What a wonderful opportunity for them.
Yeah. We have CVT students. We have pre-vet students who are, is this what I really want to do? Or I need to get some more hours and training and experience exposure that come through. And we love that. We have veterinary students that come through and do externships with us. And we just really pride ourselves in being able to share our love and enthusiasm for the field with those who are coming up. I know all of the struggles that they're facing as graduates with lots and lots of debt and not feeling ready for the position. None of us did or ever have. Sorry. Very handsome.
We have two Maine Coons, and he's the one that's most vocal and wants to be in the middle of everything.
Oh, fabulous. I thought he looked rather large.
Yes, he is. He is rather large.
Yeah. And so I forgot where I was even going with that. I apologize.
No, it's fine. If you had a magic wand and you could wave it and your business was perfect, it was exactly the way you wanted it to be, what would it look like?
Oh my goodness.
No limit. You just lay it out there.
Perfect. I would move us to an independent site. So we had all the room to support our staff, to support our clients, to let the doctors move around and have the space that they needed. I would add on a few pieces of equipment that we've been tinkering with and looking at, although really it's the staff and our know-how that we rely on the most. But veterinary medicine as a whole, I would love it if our patients rather, came in with their own credit cards that just magically got paid off. So we could say yes to everything and not stress our clients out about having to make those decisions. Although I do think we still handle that pretty well. I have ideas for all of these programs and thoughts, and whether it's client education or mentorship or training or marketing, all of these thoughts in my head would just magically get done. If it's is trying to find the time to be the doctor, the owner, the mom, the wife. It doesn't exist. There's just not enough. And
So if you had the mental space, what would you spend it on? If you could create this, you've got an extra 6 hours a week. What would you do with that time?
in honesty, I would spend it with my family more. And if I had it to spend in the clinic, it is those things that I would love to work on and continue to advance more. I would love to spend more time on training on their staff, personal development type training to help them and continue for them to advance. We really want to support our staff in growing in this profession and allowing this profession to be a career choice for them and not just a job that they outgrow and they can't afford to work in veterinary medicine anymore, which is often the reality for a lot of people that it just cannot, sometimes it just can't pay enough.
Yeah.
And trying to balance between, we don't want to overcharge our clients. We want people to have access to care and be able to afford care, not just for those who are affluent and at the high end of the pay schedule, but for everybody. We really want to make veterinary medicine and care for their pets accessible. And then to balance that with being able to pay our staff adequately so that they have good quality of life and they can afford food and the things that they need for their family and their rent, and not be in a position where they think if they call out sick, they're not going to be able to pay the bills that month.
Yeah.
It's oftentimes the reality many times for our assistants or our receptionists in this field. And so we try really hard. We overpay per the standard in the field, and we're really okay with that.
Diving in really deep on what is bogging you down? Because I see your dreams. I see you wanting to go out there and do these dreams. You come into your clinic every morning. What is it that is sapping your time? Where is it going?
It goes to charting. It goes trying to keep up with all the medical charts. It goes to, I get a lot of interesting / complex cases. So trying to research things, looking things up, that sucks a decent bit of my time. It's those millions of little questions every day that staff members have as a practice owner that they come to me for, they're little. They're like a minute and a half here, 2 minutes there, a quick question answer here,
But it interrupts.
but they interrupt the thought process. They interrupt. And sometimes I just don't even feel like it's worth starting something because I know I'm going to get interrupted so many times. Not their fault, just is what it is. And it's all those little things. I get 20 memos a day, and this person wants to know if this refill is okay, and this person has questions about this. And it's just those tiny little things all add up very quickly. To the point where I tell staff my choices, I can either get all my records done by the end of the day, I can answer everybody's questions, or I can get back to all of these things, but somehow all three of those never happen if I'm trying to do all of those at once. And then at the end of a long day where I put in 10 hours, 12 hours, sometimes seeing patients, I'm done.
Yeah. You're ready to come home.
By all those little jobs, those little things, and lack the energy, the time, the brain power at that point sometimes to do all those extra things that I want to keep adding on. I might push it and maybe I want too much.
Do you have systems or software or anything that you wish worked better?
Yeah. A lot of our communication software that we have with our clients and our patients through our clients, obviously, some of it integrates, some of it integrates very choppy with our practice management software, with our client records. And so we spend a decent amount of time adding this to over here, or we have this conversation or this email, but then we've got to cut and paste it into here, and repeating and doing a lot of those same type things over and over, answering the same questions over and over.
Client questions or employee questions or both?
Yes, both.
Yeah.
Over and over, and having a system in place to aid with training maybe some of our newer staff members as they come through.
Boarding.
Yeah, some of the onboarding. I hear there people are like, oh, yeah, just make videos. And I'm like, yeah, but when do I have the time to do that? Or when do I have the time to research how to use this technology to do this better? Like I said, AI scribing has been a lifesaver for us and has given me a little bit of my life back. And that makes a huge difference. But I now spend about 2/3 of my time in surgery and in the dental suite. And we don't currently have anything right now that works very well in there to scribe or take notes or get through those kind of things. And so I end up still being back to doing a lot of my records. So if I'm seeing rooms, outpatient rooms, the scribing helps a whole lot, but I'm
Yeah.
not figuring out either how to use that, how to utilize it, or there may not be something that works quite well yet for what I.
It's also overwhelming because there's so many options out there. There's just, and you don't even know where to start. And when you get overwhelmed, the confused mind says no. So you just go back to what you know.
Yes,
Yeah.
exactly. Yeah.
This has been so nice talking to you. I really appreciate it.
All right.
Thank you so much. I really appreciate it.
Thanks so much.
Thank you. Have a great weekend.
You too.
Bye.
Bye-bye.